So guys, we have discussed about Aspergillus fumigatus as well as Candida albicans, right? Now we shall be discussing mainly on Mucor as well as Rhizophus species, right? I mean the diseases that are caused by Mucor species. So we shall be mainly focusing on the diseases caused by Mucor species. Now, when you discuss about the diseases which are caused by Mucor species, the first important disease which you would encounter is mucormycosis, or also called as black fungus disease. Mucormycosis, or also called as black fungus, black fungal disease, right? I hope all of you know what is mucormycosis or black fungal disease. Now, if you look at the morphology, of this disease, how would the morphology be is that, first of all, we have to discuss about the septate, hyphae and all the morphology, the structure, right? So actually these hyphae, if you see this hyphae, these are actually like this, guys. Right? Now, I mean exactly this is not the picture, but anyways, what I want you to know here is that, first thing, these hyphae are broad, isn't it? They're broad. And are there any septa? No. Broad. These are non-septate hyphae, right? Now they are branching at acute angles or they're branching at wider angle. Look at this angle here. It is almost equal to 90 degrees, isn't it? So they are branching at wider angles. So first thing, by looking at the picture, you can infer that this is broad, non-septate, as well as they're branching at the wider angles, right? So let me show you the picture now. So look at this picture. These hyphae, they are thick, right? Broad. They are very broad, thick. And look at the branching. You see this branching over here. You see this branching over here. You see this branching. They are almost branched at wider angles. You see this branching. They are almost branched at wider angles. And they have no septa in between. Do you find any septa partition in between? No. Right. The disease which is caused by this Mucor species are called as mucormycosis. Now, how does this infection affect? Is that, let me draw the picture and show you the route of transmission of this infection basically, okay? Right. Now look here, guys. Look here, very important thing, that let us say this is anterior cranial fossa, this is middle cranial fossa, and this is posterior cranial fossa. And all of you very well know that this is the brain that lodges here. Okay, this is the brain that lodges here. Now, what basically happens here? And another important thing is that in the frontal region, I have got a sinus here. This is called as frontal sinus. That is not an eye, okay? That is a frontal sinus. So obviously you have your eye over here. So that would be a frontal sinus. Normally, how does this infection spread is that by spore inhalation. Let us say there are few spores here. Okay, there are few spores here. Now what has happened is that you have inhaled these spores inside. Now when you have inhaled these spores inside, these spores, they either enter into your eye or they enter into your paranasal sinuses. Okay, like frontal sinus, maxillary sinus, ethmoid sinus. So they enter into those sinuses. So let me show you that spore that is entering into the sinus. From the sinus, if you look here, there are small openings here of the cranial fossa. If you look here, there are some small openings here. Now these openings are called as cribriform plate. What are these openings? These openings are called as cribriform plate. Right? Cribriform plate. You know, your olfactory nerve goes through this cribriform plate. So through this cribriform plate, what will happen is that the spore will then enter into your brain cavity. Now the spore enters into your brain cavity mainly in the frontal region, right? Where is the cribriform plate located? nearer to the frontal region of your brain. So what is happening here? What is happening is, first of all, you have inhaled the spores, spore inhalation. Now these spores, they went into the nasal passages. From the nasal passages, either they can enter into paranasal sinuses, PNS, or they can enter into the orbit. So if they enter into the paranasal sinuses, you know the infection will be in the paranasal sinus. If they enter into the orbit, you know the entire eye will become black because it will infect the entire eye. Now, from the paranasal sinus, the infection will enter into the brain cavity, into the frontal lobe mainly, through cribriform plate. And from the cribriform plate, the infection will enter into the brain cavity and cause frontal abscess. Not only that, guys, it can even enter into the cavernous sinus and cause cavernous sinus thrombosis. Cavernous sinus thrombosis. Okay. Now another important thing you need to know is that, for example, if the infection is in the paranasal sinuses, it can affect, what I'm telling you is that the infection can go till the orbit and can stay in the orbit and cause infection of the orbit. It can go till the paranasal sinus and stay there and cause the infection. Or if it doesn't want to stay from the paranasal sinus, it can go to the frontal region of the brain and cause frontal abscess. Or it can also cause cavernous sinus thrombosis. All these things can happen, right? For example, if the infection is in the paranasal sinus, what would happen? What would happen is that the first important thing is that patient will have very severe pain. See, the paranasal sinus which I have drawn here is frontal sinus, right? So patient will have very severe pain in the frontal region and the pain will pass around the eye. Okay, so patient will have very severe pain periorbitally. Very severe periorbital pain. Patient will also have severe headache. Not only that, patient will also have through these sinuses, when there is excess inflammation or the infection in the sinus, there will be purulent discharge. There will be purulent nasal discharge. Okay. Another important thing is that these, for example, let us say this is the blood vessel, right? I'm drawing the wall of the blood vessel a little bit thicker on both the sides. Okay, so this spores or infection, whatever is there, these infections, you know, where do they grow? Where do they proliferate? They proliferate within the wall of the blood vessel. What will happen when it proliferates within the wall of the blood vessel? The entire blood vessel will become necrotic, right? The entire blood vessel will become necrotic. So important question is proliferation of this fungus. It mainly happens where? Within the wall of the blood vessel. It happens in the wall of the blood vessel. So whatever it is, when you look at the patient, you will find three important things. The three important diseases you will see in the patient. What did I tell you? It will go to the orbit, it will damage the orbit, isn't it? So when it will damage the orbit, when you look at the face of the patient, there will be a very black eschar on the face, right? So you would find a black necrotic eschar on the face of the patient. Not only that, patient will also have frontal abscess, I told you, right? So there will be rhinocerebral abscess, or patient will also have frontal abscess. Not only that, I also told you patient will also have cavernous sinus thrombosis. cavernous sinus thrombus. So these are the three important things which you would find in the patient, right? So obviously, what is the diagnosis which I would do, guys? I would show you the picture anyways. Let us look at the pictures, guys. Now look at this picture of this patient's face. This is not a traumatic injury, rather this is a fungal infection, okay? So from the nose, the infection has passed to the orbit and caused black necrotic eschar of the face, right? So the vision will be lost, obviously. So this is a black necrotic eschar. This would be black necrotic eschar. Thank God that we breathe a lot of air in a day when we go outside, right? And we are not affected with this infection. And next, the infection also affects your frontal sinus, I told you. There also will be frontal abscess. From the frontal sinus, it will go to the frontal part of your bone, frontal lobe, and it will cause frontal abscess, you see. This is frontal abscess. Frontal abscess. Now, how do you do, what is the diagnosis which you do for this patient? When you do the diagnosis, you just simply take a mucosal biopsy. In the mucosal biopsy, what will you find? The morphological signs, whatever we have discussed, right? We discussed that there will be broad hyphae, which are aseptate, which are branched at wider angles. So these things you will find in the mucosal biopsy when you put under a microscope, okay? Now what will be the treatment, guys? The treatment is a very vigorous treatment that you would be giving the patient amphotericin B. Amphotericin B, which is basically very, very costly. Amphotericin B. Apart from that, you can also give isavuconazole. Isavuconazole as well as amphotericin B. These are the two treatments of choice which we basically have. Thank you so much for watching my video. So this is the end. Goodbye and take care.